As we grow older, our bodies begin to speak to us in quieter, subtler ways. After 70, small changes that once seemed harmless can suddenly carry more meaning. An itch, for example, is easy to ignore. Many people brush it off as dry skin, aging, or the weather, but persistent itching in certain areas of the body can sometimes be a warning sign that something deeper is going on. This does not mean panic or fear, but it does mean paying attention. Today, let's talk calmly and honestly about 5 itchy places on the body that older adults should never ignore, because they may signal underlying health issues that deserve care and timely action. First, persistent itching on the lower legs is extremely common after 70, but it should not always be dismissed. Aging skin becomes thinner and drier, and circulation in the legs often slows down. When itching is constant, especially around the shins or ankles, it can point to poor blood flow, vein problems, or even early signs of heart-related circulation issues. Reduced circulation means tissues are not getting enough oxygen and nutrients, which can affect overall vitality. While this itch alone does not determine lifespan, ignoring circulation problems can allow more serious conditions to develop quietly over time. Another area many seniors experience itching is the back, particularly the upper or middle back, where it's hard to reach. This type of itch often comes without a visible rash and can feel deep, almost nerve-like. In older adults, this can sometimes be linked to nerve compression, spinal wear, or long-term nerve irritation. The nervous system plays a critical role in how the body functions as a whole. When nerve-related symptoms are ignored for years, they may gradually affect mobility, balance, and independence, factors that strongly influence quality of life. In later years, itching around the abdomen or waist area is another signal worth noticing. If this itch is persistent and unexplained, it may be related to liver or kidney strain. As we age, these organs work harder and recover more slowly. The skin often becomes a mirror of internal health, and toxin buildup in the body can sometimes show up as itching before pain or other obvious symptoms appear. Many older adults discover kidney or liver issues late simply because the early signs felt minor. Paying attention early gives the body a better chance to respond to treatment and lifestyle adjustments. Scalp itching is often blamed on dandruff or hair products, but after 70, constant scalp itching can sometimes reflect immune system changes, nutritional deficiencies, or chronic inflammation. The scalp has a rich blood supply, and changes there can hint at how well the body is nourishing itself. Poor absorption of nutrients like iron, zinc, or certain vitamins can weaken immunity and energy levels over time. While scalp itching may seem cosmetic, long-term deficiencies can slowly reduce resilience and overall health if left unaddressed. Finally, itching around the private areas is one of the most ignored and least discussed issues among seniors. Many feel embarrassed or assume it's a normal part of aging. However, persistent itching in these areas can be linked to infections, blood sugar imbalances, or immune system weakness. In older adults, conditions like diabetes often develop gradually, and skin symptoms may appear before other warning signs. Uncontrolled blood sugar can affect nearly every system in the body, influencing longevity and daily well-being. It's important to say this clearly, and it does not decide your lifespan. No single symptom can predict how long someone will live. What truly matters is how quickly and wisely you respond to what your body is trying to tell you. The danger is not the itching itself, it is ignoring it for months or years while an underlying problem quietly grows. After 70, the body no longer shouts, it whispers. Small discomforts, changes in skin, unusual sensations, all of these are messages asking for attention, not fear. Seeing a doctor, improving hydration, adjusting diet, managing stress, And treating chronic conditions early can dramatically improve both quality of life and long-term health. A long life is not just a Bouches, it's about awareness. When you listen to your body with respect and curiosity instead of denial, you give yourself the best chance to live not only longer, but better. If an itch keeps returning, don't ignore it. Your body may be asking for care, and responding today can make all the difference tomorrow. Persistent itching on the lower legs after the age of 70 is often one of the earliest and most overlooked signs that circulation is no longer working as efficiently as it should. As we grow older, blood vessels naturally lose some elasticity, and the heart has to work harder to push blood down to the feet and back up again when circulation slows. The skin on the lower legs becomes dry, thin, and poorly nourished. This lack of proper blood flow can trigger constant itching, tightness, or a crawling sensation that creams alone do not fully relieve. Many seniors assume this itching is simply old-age skin or the result of cold weather. But persistent symptoms can signal deeper vascular issues. Poor circulation means oxygen and essential nutrients are not reaching the tissues properly, while waste products are not being removed efficiently. Over time, this can lead to swelling, skin discoloration, slow healing cuts, or even open sores. These changes are not just skin problems, they reflect how well the cardiovascular system is supporting the body as a whole. Lower leg itching is also commonly associated with chronic venous insufficiency, a condition where veins struggle to return blood back to the heart. Blood pools in the legs, increasing pressure inside the veins and irritating nearby tissues and nerves. This constant stress can weaken the skin's natural barrier, making it more sensitive and prone to inflammation or infection. In older adults, even minor skin breakdowns can become serious if circulation is poor, increasing the risk of complications that affect mobility and independence. Another concern is that circulation problems often coexist with other age-related conditions such as high blood pressure, heart disease, or diabetes. These conditions may quietly progress for years with few dramatic symptoms. The skin, especially on the lower legs, can become an early warning system, showing signs long before chest pain or severe fatigue appear. Ignoring these signals means missing an opportunity for early intervention, lifestyle changes, or medical treatment that could significantly improve long-term health. Addressing persistent lower leg itching starts with paying attention rather than dismissing it. Simple steps like staying well hydrated, moisturizing daily, keeping the legs active through gentle movement, and elevating the feet can help support blood flow. More importantly, ongoing itching should prompt a medical checkup to assess circulation, heart health, and related conditions. After 70, listening to these small but meaningful signals can help prevent larger health declines and support a longer, more comfortable life. Unexplained itching on the back, especially in the upper or middle area, is something many people over 70 quietly live with for years. Because it's hard to see and even harder to reach, this type of itch is often ignored or blamed on dry skin, soap, or aging. However, when back itching persists without a visible rash or clear skin condition, it can be a sign that the nerves beneath the skin are involved. As the body ages, the spine undergoes wear and tear, discs lose cushioning, and posture changes, all of which can place pressure on nerves that send signals to the skin. Unlike surface-level itching caused by allergies or dryness, nerve-related itching often feels deep, stubborn, and oddly unsatisfying to scratch. It may come and go, worsen at night, or feel like tingling, burning, or crawling under the skin. This happens because compressed or irritated nerves misfire, sending itch signals to the brain even though the skin itself appears normal. Over time, this kind of nerve irritation can reflect broader issues in spinal health and nervous system function. The nervous system controls far more than sensation. It plays a central role in movement, balance, digestion, heart rhythm, and even immune response. When nerve problems are left unaddressed, they can slowly contribute to stiffness, reduced mobility, poor coordination, and chronic pain. These changes may seem unrelated at first, but together they can limit daily activity and independence, which are major factors in overall health and longevity after 70. Back itching can also be connected to long-term conditions such as arthritis, spinal degeneration, or past injuries that were never fully treated. In some cases, it may be linked to conditions like neuropathy, which is more common in older adults, especially those with diabetes or vitamin deficiencies, when nerve health declines. The body's ability to send clear, accurate messages weakens, increasing the risk of falls, fatigue, and slower recovery from illness. Paying attention to unexplained back itching means recognizing it as a possible signal rather than a harmless annoyance. Gentle stretching, maintaining good posture, staying physically active, and ensuring proper nutrition can support nerve health. However, persistent itching should prompt a conversation with a healthcare professional, particularly if it is accompanied by numbness, pain, or weakness after 70. The body often communicates through subtle discomforts. Listening to these early warnings and addressing nerve health proactively can help preserve mobility, confidence, and quality of life for years to come. Persistent itching around the abdomen or waist area after the age of 70 is often dismissed as dry skin, tight clothing, or an allergic reaction. However, when this itching continues without a clear external cause, it can sometimes reflect stress on internal organs, particularly the liver and kidneys. These organs play a vital role in filtering toxins, balancing fluids, and maintaining overall stability in the body. As we age, their efficiency naturally declines, and the skin can become one of the first places where internal imbalance quietly shows itself. The liver and kidneys act as the body's main detox systems when they are under strain. Waste products that are normally cleared from the bloodstream can begin to accumulate. This buildup can irritate nerve endings in the skin, leading to persistent itching that may not respond well to lotions or typical skin treatments. The abdominal area is especially sensitive because it lies close to these organs and contains a dense network of nerves and blood vessels that react quickly to internal changes. In older adults, reduced kidney function may develop slowly and without pain. Many people feel mostly fine, while subtle symptoms like fatigue, changes in urination, or unexplained itching gradually appear. Similarly, liver stress does not always cause immediate discomfort. Instead, it may first show up through skin dryness, itching, or a general sense of unease. Because these signs are mild, they are often ignored until the condition becomes more advanced and harder to manage. Abdominal itching can also be influenced by dehydration, which is common among seniors. When fluid levels are low, kidneys must work harder and skin loses its natural moisture and protective barrier. This combination can intensify itching and signal that the body is struggling to maintain balance. Certain medications frequently used after 70 can also place additional load on the liver and kidneys, making awareness of new or persistent symptoms even more important. Paying attention to abdominal itching is not about fear, but about awareness. Simple steps such as drinking adequate water, eating a balanced diet, limiting excess salt and processed foods, and following medication guidance can reduce strain on these vital organs. Most importantly, ongoing itching in this area should be discussed with a healthcare professional, especially if it comes with fatigue, swelling, or appetite changes. After 70, the body often communicates through subtle skin signals. Recognizing and responding to them early can support organ health, improve comfort, and help maintain strength and quality of life in the years ahead. Ongoing scalp itching after the age of 70 is often brushed aside as dandruff, aging hair, or a reaction to shampoo. While these causes are common, persistent scalp itching can sometimes point to deeper issues related to nutrition and immune system health. The scalp is one of the most blood-rich areas of the body, which means changes that can reflect how well the body is nourishing itself internally. When essential nutrients are lacking or the immune system becomes weakened, the scalp may respond with dryness, irritation, and constant itching. As we grow older, the body's ability to absorb nutrients from food naturally declines. Even seniors who eat regularly may not be getting enough key vitamins and minerals such as iron, zinc, vitamin B12, or vitamin D. These nutrients play a crucial role in skin repair, nerve function, and immune defense. When levels drop, the skin barrier weakens, making the scalp more sensitive to irritation, inflammation, and itching. Over time, this can also lead to thinning hair, slow healing of minor scalp injuries, and increased discomfort. The immune system also changes with age. It becomes less responsive and slower to regulate inflammation. This means the scalp may overreact to minor irritants, yeast, or bacteria that would not have caused problems earlier in life. Chronic low-grade inflammation can develop, leading to ongoing itching without obvious redness or infection. In some cases, this reflects an immune system that is working harder but less efficiently, which can affect the body's ability to fight illness and recover from stress. Scalp itching can also worsen with dehydration, which is common among older adults. When the body lacks fluids, the skin loses elasticity and moisture, and the scalp becomes dry and tight. Certain medications taken after 70 may further dry the skin or interfere with nutrient absorption, indirectly contributing to scalp discomfort. Because these changes happen gradually, many people accept them as normal aging rather than potential signs of imbalance. Paying attention to ongoing scalp itching means looking beyond surface treatments. While gentle shampoos and moisturizing products can help, they may not fully solve the problem if the root cause is internal. Ensuring adequate hydration, eating nutrient-dense foods, and addressing possible deficiencies can make a noticeable difference. Persistent scalp itching should also be discussed with a healthcare professional, especially if accompanied by fatigue, frequent infections, or unexplained weakness after 70. The body often signals internal decline through subtle skin changes. Listening to these signs early and responding with proper care can help support immune strength, comfort, and overall well-being for years to come. Persistent itching in the private areas after the age of 70 is one of the most sensitive yet important signs the body may give. Many older adults feel embarrassed to talk about it, or they assume it is simply a normal part of aging, poor hygiene, or skin dryness. Because of this discomfort, the symptom is often ignored for long periods. However, ongoing itching in these areas can sometimes be an early signal of hidden blood sugar imbalances and changes in immune strength that deserve attention rather than silence. As the body ages, its ability to regulate blood sugar becomes less efficient. Even people who have never been diagnosed with diabetes may develop gradual insulin resistance later in life, when blood sugar levels remain elevated for long periods. Excess sugar is released through urine, creating an environment that encourages irritation, dryness, and the growth of yeast or bacteria in sensitive areas. This can lead to persistent itching, burning, or discomfort that keeps returning despite basic treatments. High blood sugar also weakens the immune system over time. White blood cells become less effective at fighting infections, allowing minor irritations to turn into chronic problems. In private areas, where the skin is delicate and moisture is common, this immune decline can cause recurring itching without obvious sores or rashes. Because pain may be minimal, many seniors tolerate the discomfort instead of seeking medical advice, allowing the underlying imbalance to continue unchecked: dehydration and reduced skin elasticity. Both common after 70, can further worsen the problem. When the skin barrier breaks down, it becomes easier for irritants and microorganisms to trigger inflammation. Certain medications frequently prescribed in later life can also alter blood sugar levels or dry out sensitive skin indirectly, contributing to ongoing itching. These factors often overlap, making the symptom feel confusing or difficult to explain, which leads many people to simply endure it. Ignoring persistent itching in private areas is risky not because of the itch itself, but because of what it may represent internally. Long-term blood sugar imbalance affects nearly every system in the body, including the heart, kidneys, nerves, and brain. Early signs on the skin can appear years before more serious complications develop. Paying attention early offers a chance to slow or even prevent further damage. Addressing this issue begins with awareness and openness, maintaining proper hydration, wearing breathable clothing, and keeping blood sugar levels monitored can help reduce symptoms. Most importantly, persistent itching should be discussed with a healthcare professional without embarrassment. After 70, the body often sends quiet signals instead of loud warnings. Listening to them with honesty and care can protect health, preserve comfort, and support a longer, healthier life.